Hi, so we've really covered a lot. So we've covered things ranging on the channel from clinical communication to anatomy and a bit of physiology. Now it's important to talk a little bit now on clinical examination. And I think overall there's a lot of tons of very good videos on, in terms of technique. I think probably what is missing is the synopsis, sort of an approach to complete a proper OSCE examination. That's what at least I've gotten from feedback from colleagues and students. And so at the academy, we've taken the approach of creating what we called the focus synopsis, or the synopsis of a focus clinical examination for OSCEs. And I'm going to use the thyroid examination to illustrate this. Now, the thyroid examination, the typical OSCE would last, depending, but about 10 minutes. And to deliver this at a proper reading rate and sequence, you need to have a synopsis, sort of like a script, if you like, to how you would deliver that. And at the academy, that is the script we want to give you for as many of the clinical examinations as possible. Now, the very first thing to remember to break down the script for the thyroid exam, you need to remember hands, eyes, gland, lymph nodes, and limbs. So there are 5 things in the script. You have hands, eyes, gland, lymph nodes, and limbs. Now, if you remember that, some students like to remember them with alphabetical letters. So that's egg, heg, LL. That's HEGLL. All right. Now, the examination typically would start with the introduction rapport, which typically most people would use the mnemonic called wiper to handle that part, which is wash your hands, introduce yourself, permission, position, exposure, and reposition. Now, once you've done that, of course, for most clinical examination, the principles of inspection, followed by palpation, percussion, or auscultation, either all of this would apply or some of these in a varying combination. Now back to thyroid exam. So the very first thing you want to deal with is the hands. So I teach the principle of probably 4 P's in the hands. So you want to look at palmar, palmar opposite, pulse, and then you want to ask the patient to paper. So this about 4 things do you want to examine in the hands when you start examining the hands. After the hands, you want to now go to examine the eyes, which there are various other videos on YouTube and in standard text that deal with the eyes exam. The next thing after you've done that, you want to go and examine the glands. Then after the glands, you want to examine the lymph nodes. And then eventually you want to examine the limbs. Important in the examination of the limbs. What you are doing in the limbs is the reflexes, proximal myopathy, and you're looking at the shims, for myxedema. And you want to ask the patient to do this and stand up. So I hope this synopsis gives you an easy way, something like a script to have at the back of your mind under the pressure of a real OSCE exam. So for recap, you remember that it's a script, so it's wiper plus hands, eyes, gland, lymph nodes, and limbs. So I hope this summary is helpful.